The topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good morning, Texas. Welcome to another Ask the Expert show. Yeah, I did. I said Texas. We have our expert who's coming on with us first is becoming such a popular show. And our last show, we got calls from Houston and San Antonio. And I've learned that when you have an expert who is as incredible as this expert is, that people will come in from all over the state of Texas. We know that there is a major problem out there with neuropathy, and we were able to find one of the top specialists in that area. Let me welcome you to Dr. Tim Uselton.
Hey, good morning, Steve-O. How are you today?
Hi, Tim. How you doing?
Doing great, doing great.
Hey, this is our first Texas show, and I was just telling everybody, I said, this show has become so popular that not only are we going to do, and it's really important to jot this down, we're going to do the first Tuesday at 9 o'clock Central Time every month, and then we're going to replay this the middle of each month. We'll be promoting that, and we're also providing this to everybody in the state of Texas. Tim, what you do is that important. Good morning to you.
Good morning. I'm super excited to be a part of this now for the next little bit coming up. And
exactly.
It is such a need, so I'm happy to share.
Well, you know, Tim, gosh, it's almost been recently that you have so many ways of treating neuropathy. I know for a fact, because I have a friend of mine, that they were told that there's nothing can be done about neuropathy. You're stuck with it. And Tim, you have developed treatments that you're going to help. Now, I wish you could say it's 100%. It's not, but your success rate is incredible. Tell us about your practice.
Okay, well, we're located right here in Carrollton, Texas, our brick and mortar, and it's a suburb of Dallas. And we got board certified back in 2018, specifically in neuropathy, just because of that. Like you said, so many people walk in our doors and they say, I've been to so many doctors and they all tell me the same thing. There's nothing that can be done. And so we're fighting this uphill battle and getting the word out and educating people that there is something that can be done. You don't have to rely just on medication to cover up these symptoms. Things like gabapentin and Cymbalta, and these are drugs that don't ever really fix the problem. And most people know and understand that, but they're just trying to cope with the numbness and the pain and the burning, typically in the feet, but could be in the hands as well. We had a patient last week that had it in both the hands and the feet at the same time. It hit her pretty quickly. So it can come on very quickly and really rock your world, because you start to not be able to, hold the cup of coffee that you have every morning because you don't feel it in your hand, or you don't feel like you're safe in driving because of the numbness of your feet. You can't feel the pedals under your feet, so you don't know how hard you're going to push the gas. All of a sudden you slam on the brakes because you just meant to touch it and you can't feel it. So it's a real problem, and there are real solutions out there now, thankfully, that we can go forward with and not just continue to medicate and mask those symptoms.
Tim, the patient you had that had in both hands, is there swelling along with that?
Typically, that could be one of the findings, but typically it's not. If they're swelling, it may just be a little bit more of the edema because the venous return of that tissue into our lymphatic system and the actual blood flow coming out of there, it kind of stagnates a little bit. And so you get this edema, a lymphedema sometimes. And that's not as common as just the most common symptoms are like numbness. It starts as I don't feel my foot as well. And then the more advanced it gets, you feel the tingling, the pins and needles, as if, you cut the circulation off to something and it started to tingle. You feel those symptoms. And then it can go all the way to the other end of the spectrum where it's an actual sharp pain that you feel like something's, a hot burning piece of metal is being, applied to your foot. Or some people, it's just super cold feelings. People lose their sense of balance when that happens. And then the number one most common thing that gets the person to actually go see the doctor, research shows it's after a fall. And so now there are very common ICD-10 codes that we use in the industry of healthcare that help us diagnose people. And there's actually codes now on the most recent updates of our codes that say this person frequently falls. We diagnose them actually with a falling condition because of the numbness in their feet. And then when they fall, it could be that they break a hip or they injure a hip or hurt a low back. And then they go to the doctor and they say, well, the reason I'm here is because, not really because of my low back, it's because I fell. And they go, oh, well, how long have you been dealing with this? Oh, I've had numbness in my feet for years and years and years. They just didn't put two and two together that they were, suffering from a debilitating, degenerating condition. By definition, neuropathy doesn't get better over time. It gets worse.
Tim, did you ever think when you were going to chiropractic school that you would be specializing in neuropathy?
I did not. I got into healthcare because I wanted to help people. I saw a chiropractor when I was in middle school and high school actually help my mom. I didn't see them as a patient. I saw them, what they did to my mother, went from not being able to move and function and take care of me at home when I was, in school, couldn't cook and clean and do the things I thought a mom had to do. We carried my mom to a chiropractor. We carried her into the building. She could not walk. And he did some magic on her. He clicked her heels together and did some stuff. And I just thought that was the crazy, most outlandish thing I ever saw. But she stood up and walked out. She didn't get injections. She didn't get weeks and months of rehab. She didn't get a prescription for pain meds. He just did something mechanically to her back, and she was able to walk and pain-free. So at that moment, I made the decision. I wanted to help people in this way without the drugs, without the surgery. But then fast forward to 2018, after being in practice for over 20 years, I saw neuropathy patients coming in, continue to come in. I went to a seminar back in 2017 that was all medical doctors in the room, and I was one of the only chiros. And they said, is any chiropractors in the room? And I raised my hand and looked around, and I was the only one. And they said, we're jealous of you because you have a way to work on neuropathy that none of the rest of us have, because at our disposal is medication. At your disposal is some physical medicine things that will actually change the anatomy, increase the blood flow, help the damaged nerves restore. And so, that they kind of challenged me in that way. And they said, we're in this room kind of causing this problem because one of the massive side effects of one of the drugs that they treat high cholesterol with is peripheral neuropathy symptoms. And so if people are out there and their high cholesterol is causing them to get on a statin medication, like the generic atorvastatin calcium, which is also known as Lipitor, those drugs, when you read the side effects label, it says peripheral neuropathy. So in this seminar back in 2017, they were saying, we're out here prescribing all these cholesterol meds. And now in the next few years, you're going to be treating these people for neuropathy because we know it causes a peripheral neuropathy in a certain number of people. And that's the only thing we can do is treat them and then offer them more meds later. And you guys can actually treat them. So I determined at that point that, yes, I was going to go deeper into this neuropathy because there was not a clear solution at the time in our medical world, in Western medicine. So I chose that route. And yeah, fast forward to now, after having done this now, I guess about 6 years, we have some really innovative things, some outside of the box thinking, things that really help fix the problem, not just cover it up.
Tim, we just got a text. You're in Carrollton. We're here in Florida. Somebody just wrote, I'm so glad you're bringing this show on. I want to know, is your office close to Beltline?
Yeah, not too far from Beltline. Yeah, that's one of the
Okay.
major thoroughfares in Farmers Branch, Carrollton area. That's where our downtown Carrollton area is. We're not too
Okay.
far from that.
So I want, Tim, because I know how much you do care about your patients, and our show is on neuropathy, but I just want, before we get into it, tell people what other areas you treat.
Okay, so we specialize in three main niches, and one of them obviously is neuropathy. And then there's some various ways we treat that within that niche. But then the other things that we treat, obviously, we have a full-on physical medicine clinic. So we do the PT, we do the chiropractic work, we do some all-natural injections. So we can really work on spines very well. We can work on discs that have degenerated in the spine, specifically with our non-surgical spinal decompression therapy. And then the other niche besides the spine would be just major joint pain. We got into regenerative medicine in about 2015. And so now we can actually put those regenerating cells back into a person's joint and help rebuild that damaged cartilage that until the inclusion of regenerative medicine within our practice, before that, it was just off to the surgeon to have a full total knee replacement or a hip replacement. And now we're seeing that we can save those joints actually and not just cut them out.
Tim, I know you hear this all the time when it comes to a person's back, and they say, the doctor wants to do surgery. Back surgery is pretty dangerous, and there's a
It
lot
is
of things
dangerous.
that go wrong. And
Yeah,
I love you can treat people.
absolutely. The surgeon, I don't say this in a demeaning way, but we treat people the way we're trained, and surgeons are trained to cut. And so it's kind of like the old adage: if you're a hammer, then everyone that walks in looks like a nail. And so, that their method of choice is to do surgery. And there are some instances after major trauma, after fractures, you got to have that set, and sometimes that requires surgery. But as far as just jumping to the total knee replacement because there's arthritis in it, those days are gone. Most orthopedics now are even getting into the regenerative medicine game because they see the evidence-based science behind it. They see that it's a very minimally invasive. They see that it, worst case scenarios, it didn't work, and you can always do surgery. But if you jump to the end of the road, so to speak, with surgery, you can't go back and try these other things. So we have a very good success at treating these backs and joints without using surgery and without even using drugs. In fact, we've removed steroid injections from our practice. We don't even do the steroid injections because of the harmful side effects that they cause.
Right. God, you just got my attention big time. So I had to have both knees replaced, and the expression they use, bone on bone.
Yep.
So are there times where you can maybe treat that and not have to have the knee replacement?
Absolutely. Yeah.
Wow.
So now the research is showing that, when you're born, you have the most amount of regenerating cells ever in your body. Because if you can, think from birth, the previous 9 months, you started as a single cell organism in utero. And within 9 months' time, you developed over 100 trillion cells. No other time for the rest of our life can we see that much multiplication and growth. And so when you're born, your growth factors are way up here, all those regenerating cells and tissues. And by the time you're 18 years of age, you're not even skeletally mature yet. Most research shows that you have about half of those numbers of regenerating cells. By the time you're 65, forget about it. You at 65, research shows that you're lucky if you have 5% of the number of cells that regenerate that you were born with. And so that's why, I'm 52 years old. And when I was little, I had a car accident on the way to school one day when I was a little bitty kid in elementary school, and my head went through the windshield. And then the rest of the story is that I went to school that day and had no problems. And now I'm 52. I step off of a curb wrong and my back is out for 2 months. It's like those cells that are there early on are not there later. So I said that to say now we can take those cells out of a person and we can concentrate them and raise their concentration level and their efficacy. And we can then put them back into a joint space and they go to work as if maybe not when we were born, they're not that high of a level. And they're maybe not even up to half, but they're up to 30, 40%, maybe when you were 30 years old, 35 years old. And the body feels that way again in that joint, and it recruits all those other surrounding tissues to come in and start to repair. So we have definitely bone-on-bone patients that we're able to reverse that process on. Yeah.
I know one of the hardest parts for me was the rehab. What is the rehab any different when you perform this?
Oh, it's absolutely much different. If you think about the rehab of a knee replacement, you're having to retrain and re-show all of those
Right.
ligaments and tendons what to do. We take the knee in the condition that it's in and just add the regenerative tissue in the space where that is bone on bone, where that cartilage used to be, and the body starts to lay down new scaffolding and new cartilage in that area. So the rehab is very minimal. We might treat someone for a few months afterwards, but you wouldn't look at it and think that it was anything close to what we do post-surgical, because we do post-surgical rehabs here as well. We have 3 active knee replacement surgeries here right now that came to us after their surgery, and we didn't catch them before it, or else I would have tried to get them to do the regeneration first.
Tim, I got to tell you, I am so blown away. I know we're talking about neuropathy, but I want people to know everything you do. And again, coming from a person who had both knees replaced, had to go through the rehab, if I'd have known that this even existed, I don't even care if you had a 50% chance success rate, I would still do this first.
Yeah. Well, yeah, I appreciate you helping me spread the word, because it's true. People just don't know. They don't know what they don't know. And they go to an orthopedist. And like I said, he says, you're bone on bone. And the only thing in his tool bag is surgery. And he's not going to say, well, there's this guy over here that might do something a little different than me, so you should go check him out. And so, again, no belittling or talking down on them. They do an amazing job. And hopefully your knee surgery turns out very good for you. But they do fail in 40 to 50% of the cases. The hardware that we put in knees in this country is designed to last about 12 to 15 years.
Yes, that's right.
If you outlive those joints that are artificial, then they start talking to you at some point about how the reason why it's hanging up on you is because of the hardware failing, and they want to go in and maybe redo that. And you only get one shot at redoing it, or else you got to amputate. So we never recommend the total knee replacement on someone in their, say, 30s or 40s, because they're definitely going to more than likely outlive those knees. But yeah, and you mentioned that we do other things other than neuropathy, but there's a direct tie-in to neuropathy here, because we do some of the same treatments to regenerate joint tissue that we use in neuropathy to generate nerves and blood flow into those areas. Because ultimately, neuropathy, if you look down to the deepest cause of it, neuropathy is related to a lack of blood flow that should be delivering oxygen and nutrients into the nerve. It no longer gets to do that because of levels of inflammation in our body. Most commonly, that's diabetes, causes that spike in blood sugar, and then that blood sugar causes all that inflammation in and around the area. The blood flow slows down. It diminishes to the point that the nerve starts to dwindle and die. And then you take gabapentin. Makes no sense. Doesn't do anything to the tissue to change it. It just covers up that symptom going to your brain. So we, in turn, will do things to start to increase that blood flow to the area, increase the regenerating cells to that area, if you will, put in that regenerating tissue that we've concentrated, and help boost that growth and actually reverse the nerve damage, causing the neuropathy, the idiopathic peripheral neuropathy, the diabetic neuropathy, the polyneuropathies, all those different neuropathies. The commonality in them is decreased blood flow or diminished blood flow to the point that the blood flow is completely cut off. And then we know what happens when there's no longer any nutrients and blood flow and oxygen to the tissue. The tissue dies, and that results in an amputation. And so you look at the insurance coverage on neuropathy, they say we cover gabapentin. We cover a walker when you can't walk anymore and you need help and assistance with balance. And then we're going to cover the amputation that you might need in the future as well. It's like, wait a minute, you're covering all the things that are getting me to the point of losing my toes. And there's something way over here that can actually change and reverse it. And we have about a 90% success rate in helping people that are very, very, they have neuropathy very, very significant. Like we're talking 60, 70, 80% of sensory loss in their feet after we do our testing on them. We can reverse that.
Tim, do children get neuropathy?
Not as often. It is a disease that requires the inflammation to be in the tissue for a while. People say, oh, this neuropathy just started, last 2 weeks, I started feeling numbness. However, I've been a diabetic for, 50 years. Okay, well, this spike in your blood sugar and this inflammation in the tissue did not start 2 weeks ago. It's now damaged the nerve because it's been there for so long. So time is a factor, and with time being a factor, it's harder for a child to get it. I think that we've seen people in their 40s that have truly a sense of neuropathy, but not many in their 30s or younger have we seen in our office.
Do you notice if there's a gender? I mean, do more men or more women get neuropathy?
That's a great question, because the research shows that women get it more often, but also the research shows that men don't go to the doctor when they get it.
That makes sense.
So we have more incidences documented of females, but it's estimated that, I think there's something like 65 million Americans that have been diagnosed or that are currently diagnosed with it. And that seems like a huge, huge number. And that doesn't include everyone that's got it that hasn't been documented. There's people walking around every day. We see patients in this office, and I say, where have you been to get this treated? And they say, nowhere. I've been dealing with it on my own. So with that number, that could be a double of that number, honestly, in reality. And so men, women, not sure, because men don't really go. If men come into my office, their wives are, forcing them to usually. They're like, oh, I can handle this. But we get results with both male and female. So I don't think there's a hormonal component to it or any predisposition because of being a female versus male. But yeah, it's we do see more women than men. Yeah.
We're getting a lot of people writing, Tim. Does insurance cover this?
So the insurance covers treatment for neuropathy, but that treatment is something that we don't deem as very effective. They cover the medications that you can take. The most popular one is an anti-seizure medication, which doesn't really make sense, but an anti-seizure medication called gabapentin. It's hard to get off of once you start. You have to titrate off of it. We've helped a lot of patients get off of that because our treatments work better if you're not on that, as opposed to continuing to take that and do our treatments. But insurance covers the gabapentin, the Cymbalta type prescriptions. It covers, like I said, the assisted walking devices, canes, wheelchairs, walkers. It covers the surgery that you're going to need at the very end with the amputation or the ER visit. It'll cover.
Where's the treatment at, Tim?
Exactly. They don't cover the real treatment. And so what we do in the office is a couple of different programs. And this is important. I know we're out of time, but a couple of very important things is we have an in-office treatment that gets really, really the best results. And we have an at-home treatment that also gets results. It may take a little longer, but there's nutritional components that are very important. There's some at-home devices that are very, very important. And everything we do is concentrated on get the blood flow, bringing oxygen and nutrition back into the body, into the tissue. And so we do then now that enables us to treat people from anywhere. We can ship them our product. We can ship them our device. We can let them know how it works. I can train them online through video chats. And we can go treating now people from Vegas and California and Florida and Tennessee and Oklahoma and Arkansas and Alabama and Louisiana. We got patients from all over because I can do a consult on the phone with them. I can do a consult on video chat with them like us doing this today. And we can actually get them the help that they need without them even coming into our office. Now, if they're local to our area and they can make the 24 to 30 sessions to start with, they'll get a big bump boost quicker than those people at the at-home. But we do have very good success rates with online reviews of our at-home therapy as well. So it's kind of twofold, in the office and at home. Most of what we do here, though, is not covered by insurance when it comes to that.
We've been running Tim's phone number during the show, but for those listening on radio or podcast, tell them how they can reach your office, Tim.
You bet. The easiest way is just our web address. It's Trinity Integrated Medical, 3 words, Trinity, like the Holy Trinity, integrated, meaning we've put things together from various forms of medicine, medical, not Trinity Integrated Medicine, Trinity Integrated Medical. We're a medical office.com. Once you go there, you can read about our neuropathy treatments. You can get our phone number. You can have a contact form. You can see what insurances we do cover and what those therapies look like. We can see what our non-insurance covered things do that and what they look like. You can look at all that on our website and reach out to us, and we're very available digitally through the markets, through the social media, through text messaging and that sort of thing. So if you reach out to us in any way, you can Google my name, Tim Usselton, and my clinic will pop up, and then you can go from there.
Well, I just want to throw this in. Chiropractic has become so valuable that, God, 25 years ago, you wouldn't see a professional football or basketball team who had a designated chiropractor. Now it's all part of the package. You will not see an athlete go without a chiropractor. That's how important your field is.
Yeah. Oh, I've got a buddy that travels with the PGA golfers, and they'll in between rounds, they'll stop in his little trailer, and he'll work them over with his hands. He'll follow them around the course sometimes. And they all understand the importance of it. It's about performance. It's about better alignment, balance. It's about all those things. But yeah, we've just taken it to a couple of new levels over the last 25 years for sure.
Tim, I love what you do.
Good old days have changed for sure. And when it comes to chiropractic care.
So Tim's going to be back again. Remember this first Tuesday of the month at 9:00 Central. We'll be running this show again the middle of the month. We will let you know. Tim, thank you, buddy.
Oh, you're welcome. Thank you. And I look forward to sharing again next time.
Love it. Thanks so much, Tim. That's Dr. Tim Usselton. Amazing. He can treat neuropathy. We're going to go a short break. We'll be right back.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.